because you are writing it every day. I extend my warm welcome to all dignitaries, guests, and delegates present here for Dr. Sudhir Raj Yen Memorial Free Webinar Series organized by DIKSHA E-Academy. Today's session, we will be discussing about diagnosis and management of Timira by Dr. Ashwini BN. Before starting the session, I would like to go through few of the basic instructions to be followed throughout the session. For uninterrupted class session, use laptop with high-speed internet connection. Please make sure your microphone is on mute to have a disturbance-free session. In case of any disruption, please check your internet connection first. And if the problem is within our network connection, kindly raise the issue in the chat box. Filling your full name to be displayed is appreciated. Any questions can be raised, posted in the chat box. Questions raised will be cleared at the end of the session. It's a great pleasure for me to introduce our guest speaker, Dr. Ashwini BN. Doctor graduated from Ashwini Ayurveda Medical College and completed a PG in MS Shalakya from SDM College of Ayurveda and Hospital, Asan. She is currently working as Associate Professor in the Department of Postgraduation Studies in Shalakya Tantra, Amrita School of Ayurveda, Kerala. She has 10 years of experience in teaching UG and PG scholars and been guiding postgraduate scholar research projects. She has clinical experience in treating ocular surface disorders, posterior segment diseases, and ENT diseases. Doctor has published 21 articles. She has delivered guest lecture at various reputed platforms and conducted hands-on training on Ayurveda procedures employed in the treatment of eye and ENT diseases. We are extremely privileged to have you in our platform, ma'am. Now, without any further ado, we will turn the time over to respected Dr. Ashwini ma'am to enlighten our minds with her knowledge. Over to you, ma'am.
Thank you, Dr. Jinsi, for the brief introduction. Good evening, everyone. So at the outset, I would like to thank the DIKSHA organizers for providing me this opportunity to share my views. So without much ado, we'll start our discussion today. Is it seeing my slides? Hello?
Yes, ma'am. The slides are visible, ma'am.
Okay. So today we will be having discussion on the topic diagnosis and management of Timira. So Timira is nothing but the blurring of vision. This is the most commonest complaint presented to the ophthalmic OPD in practice. So blurring of vision, it is having wide variety of causes. It may be as simple as a simple myopia, where the disturbance of vision can vary up to 6/9 or 6/12, and to sight-threatening causes also. So as we all know, we are going to measure vision through Snellen's chart. So it may be as simple as 6/6 partial, or it may be 3/60 or 2/60, where the person is able to appreciate the topmost letter only from the distance of 2 meters. So whatever may be the severity of blurring of vision, the patient comes and says that I have blurring of vision. So it's very important to identify what is the cause, because it is having wide range of causes. So blurring of vision to complete loss of vision. Even the disturbance of the vision, it can be difficulty for distant vision, near vision, or distorted vision. Whatever may be the disturbance in the vision, the patient presents as blurring of vision. So it can be 6/9, or it can be up to loss of perception of light also, where the person is unable to appreciate even the light. So it's important to identify whether it is a reversible cause or irreversible cause of vision loss, especially the preventable causes that comes under the scope of Ayurveda. So we have to identify whether it is preventable or it is reversible, irreversible. That is very, very important to identify, because we are dealing with the neural tissue. Retina is a neural tissue. Once it undergoes degeneration, it's very, very difficult to regenerate it. It's difficult to get even the vision back. So it's important to identify whether it is preventable or reversible cause of blindness, because If at all it is an irreversible cause of blindness, we have to educate the patient about the prognosis. We have to educate the patient that the outcome will be guarded. So then only we can take up the patient for further treatment. So where do we get the references of blurring of vision in Ayurveda? So in Ayurveda, we have a separate chapter dealing with Drishtigata Rogas, where Acharyas, he has explained almost all types of disturbances in the vision. So in that chapter, in Sushruta Uttaratantra, he describes about a entity called as Drishti, which is responsible for the perception of vision. So in the further slides, we will look into what are the features of Drishti and how we are going to perceive the vision. And one more important point, what we have to keep in our mind is about Alochika Pitta. So Alochika Pitta is a type of Pitta, special type of Pitta, which is residing only in Netra. And according to Acharya Bela, he has classified Alochika Pitta into Chakshu Vaisheshika Alochika Pitta and Buddhi Vaisheshika Alochika Pitta. So if you look into the physiology of vision, so if you see this picture, so the light enters into the eyeball, passing through the optical media from cornea, the aqueous, the lens, vitreous, and then it falls on the retina to form an image. So the light energy will be converted into electrical energy, and then the electrical energy will be transmitted through the optic nerve into the chiasma, then to the tract, then to the radiations, then to the visual cortex. So if we analyze what are the functions of Chakshu Vaisheshika and Buddhi Vaisheshika Alochika Pitta, we can analyze like the function, the formation of image carrying the impulses till the visual cortex will be the function of Chakshu Vaisheshika Alochika Pitta, whereas Buddhi Vaisheshika, it is concerned with the analysis of the image. So these points are important. So we have 17 Drishtigata Rogas according to Acharya Sushruta, where he has incorporated almost all types of disturbance in the vision. So here I'm not going to deal in diseases in detail because it is not possible to cover in this short span. So instead we will cover it in symptom wise. So we have 7 Drishtigata Rogas, Timira, Linganasha, and other diseases also, where we find a variety of complaints or variety of symptoms like difficulty for distant vision, difficulty for near vision, distorted vision, diplopia, polyopia, even disturbance in the color vision, scotoma, constriction of the visual field, flashes of light, floaters, chromatopsia, disturbance in the color vision. All these symptoms will be dealt only in Drishtigata Rogas. So Drishtigata Rogas it is not only blurring of vision, or it is not only difficulty for distant vision, even other types of disturbances in the vision, polyopia, diplopia, everything will be dealt in Drishtigata Rogas only. So before starting with Timira Linganasha, I would like to give a brief introduction about the entity called as Drishti. So Drishti, actually it is situated in the 4 patalas. We have 6 patalas, 2 Bahya patalas and 4 Abhyantara patalas. So in these Abhyantara patalas, the Drishti is situated. And Acharya Sushruta and Sushruta Uttaratantra 7th chapter, he describes about the features of Drishti. So according to the context, the Drishti can be sometimes taken as anatomical entity, sometimes it can be a physiological entity. So that we are going to understand in this particular shloka. So he says, Masuradana matram tu panchabhuta prasadajam khadyota vispulingavamidam tejobiravyavaihi avratam patalinachno bahena vivarakratim shita satyam granam drishtimahu nayana chintakaha. So Masuradana matra should be taken as the size of the drishti. So if you consider the size, in some context we can take it as pupil, in some context we can take it as macula, in other context we can take it as optic nerve head also. Panchabhuta prasadajam, it is nourished by all the Mahabhutas but predominated by Agni Mahabhuta, and he has compared the Drishti or the feature of Drishti, he explains as Khadyota and Vispulinga. Khadyota and Vispulinga is the spark of a fire. So if you see the Drishti, it sparkles like a fire, the spark of a fire. So that can be analyzed with the foveal reflex. So we have an instrument called as ophthalmoscope, direct and indirect ophthalmoscope. So when we examine the fundus, when we examine the retina, we have an area called as structure called as macula. In that we have the center part called as foveola, which is responsible for the maximum vision, for depth perception, for color perception, for form sense, and the maximum peak of vision we have in happens because of this particular area called as foveola. So when we examine the foveola, typically it looks like Khadyota and Vispulinga. So that foveal reflex resembles like Khadyota and Vispulinga. In certain conditions, when the macula is affected, either because of macular hole or edema, this reflex will be reduced. Then Tejobir Avyavaihi. Tejobir Avyavaihi, Dalhana, he comments as Upachaya Apachaya Rahita. There won't be much physiological variations or diurnal variations in the pitta which is residing in the netra. So that is the speciality of this particular pitta which is residing in the netra. Then he says Avratam Pataleenakshnu Bhakhena Vivarakratim. So he says the drishti is all around covered by the patalas. So in this picture you can see we have the retina. We have this retina here. Okay, this is the macula. This is the vascular layer, and then we have the fibrous core. So this can be analyzed as the patalas, which is covering the drishti. So then he says, Dalhana, he will get a doubt like if at all it is covered by all around by the patalas, then how do we have perception of vision? For that he explains that there is a vivarakara. So vivarakara, he says chidra. Okay, chidra is not actually a virtual hole which is present in the eyeball. Rather, it should be understood as the optical transparency of the ocular structures which helps in the transmission of the light rays. So certain structures in the eye should be transparent for the light rays to enter into the eyeball and then fall on the macula for the perception of the image. So those structures are cornea, then we have the aqueous, then lens, then vitreous. So these structures should be transparent in order to perceive the vision. So the optical transparency of these structures can be understood as vivarakara rather than taking it as a virtual hole. Then drishti is shita satnya. So this point has to be considered in your mind when you are selecting the treatment procedures and also when you are selecting the drugs for the treatment of netragata rogas, especially when it is concerned with the drishti. It is shita satnya. So the temperature also should be maintained, and also the drugs what we are selecting also should be having shita virya. Then we have an important concept called as patalas. So patalas, as I told before, the drishti is situated in the patalas. From anterior to posterior, Sushrita and Vakpata both they explain that from anterior to posterior they are placed like Tejojalashrita, Mamsashrita, Medhashrita and Astyashrita. Why I am highlighting this particular point is because in case of Drishtigata Rogas, it will be the opposite way. Like first patala will be Astyashrita patala, second patala will be Medhashrita patala, third patala will be Mamsashrita, and then fourth we have the Tejojalashrita. So it will be vice versa in case of Drishtigata Rogas. Why? Because in Ashtanga Sangraha, Drishtigata Roga chapter, he explains Abhyantara Sthanam Siranam Bahir Mukatvat Bahir Nirgachato Malasya Pratama Abhyantara Patala Samshrayatvat Abhyantara Patalameva Pratama Patala. So the doshas they get vitiated in the koshta, they move upwards through the Urdhvagami siras, they come to the netra, and from inside outwards it is moving. So from inside outwards when it is moving, the first patala encountered will be Astyashrita patala, then we have the Medhashrita, then we have the Mamsashrita, then we have the Tejojalashrita. So first two patalas when it is involved, we call it as Timira. When the doshas are involving the third patala, we call it as Kacha. When the dosha is covering all the four patalas, we call it as Linganasha. So Linganasha means Chakshurendriya Shakti Nasha. Chakshurendriya Shakti is nothing but the perception of vision. So when the person is losing the perception of vision, or when the person becomes dependent upon others even for his routine activities, that particular stage we have to consider it as Linganasha rather than taking it as PL negative. PL negative is perception of light negative. So perception of light negative means the entire retina, the whole of the retina is atrophied, it is non-functional. So in those conditions, even if you do some treatment also, the outcome will be guarded. So rather than considering it as PL negative, we have to take it as Chakshurendriya Shakti Nasha, as the person when he becomes dependent upon others on his for even carrying out his routine activities, those conditions also should be taken as Linganasha. It's a condition where all the four patalas are involved. So before starting Timira Kacha Linganasha, we have two concepts. Acharya Sushrita and Vagbata both they explain Patalagata Dosha Lakshanas separately. Then only he will explain about different types of Timira Kacha and Linganasha. So Patalagata Doshas, all the doshas when they enter into the Pratama Patala, what will be the general Lakshanas? When they enter into the second Patala, what will be the general Lakshanas? Like that, he will explain for all the 4 patalas. Then only he will come to specific dosha related Pratama Timira, Kacha, Linganasha. So this is important because whenever we are coming for a diagnosis or whenever we are arriving at a diagnosis, we have to club these two concepts. Like if at all we are dealing with myopia, it will be myopia should be treated on the lines of Pradama Patalagata, Vataja, Timira. So dosha along with the patala, we are going to club and we are going to diagnose the case. So these two concepts should not be taken as two separate concepts. Rather, they both should be clubbed together and then only we can arrive at a proper diagnosis. So Pratama Patalagata Dosha Lakshana. So in Pratama Patala, either it may be Vata, Pitta, Kapha, Rakta or whatever the doshas, when they enter into the Pratama Patala, first Patala, what will be the Lakshana? So he says, Avyaktani Sarupani Sarvaneva Prapashiti. So that is the only feature that is seen when the doshas are entering into the first Patala. That is Avyakta Rupa Darshana. That is blurring of vision. Whatever he sees, that there will be blurring of vision. The same thing will be explained in Timira, in Kacha, and the same thing in Linganasha also. But how do we restrict this Timira, or how do we understand this Timira in terms of Snellen's chart? That is what I'm going to explain now. So we have Snellen's chart where we are going to ask the patient to sit at a distance of 6 meters and we are going to ask the patient to read out the letters in the Snellen's chart. So we have 6 by 6, 6 by 9, 6 by 12, 18, 36, 60 like that. So usually 6 by 6 partial to 6 by 18 or 6 by 24, we take it as Timira. 6 by 36 to almost 3 by 60 or 4 by 60, we take it as Kacha. Below 3 by 60, we take it as Linganasha because the blurring of vision or Avyakta Rupa Darshana, we don't have any grading for Avyakta Rupa Darshana. Avyakta Rupa Darshana, it can be simple blurring of vision or it can be a condition where the person is not able to identify the features of an object. So that is also Avyakta Rupa Darshana. So it's important to restrict ourselves which stage should be taken as Timira, which stage should be taken as Kacha, and then how it should be defined as Linganasha. So usually 6 by 6 partial to 6 by 18, we can take it as Timira. So the causes can be many causes are there that we will be dealing in the further slides. Then in the Dvitiya Patala, when the doshas enter into the Dvitiya Patala, irrespective of the dosha, either it may be Vata, Pitta, Kapha or any other doshas or in combination of doshas, when they enter into the second Patala, what will be the Lakshana? He says, Makshika Mashakan Keshan Jalakani Chapashiti, Mandalani Patankamscha, Marichihi Kundalani, Parimplavasha Vividan, Varshamabra Tamamsicha, Durastani Picha Rupani, Manyatecha Samipataha, Samipastani Durecha, Drishtir Gochara Vibramat, Yatnavana Picha Atyatam, Suchi Pamshana Pashiti. Makshika Mashakan Keshan Jalakani Chapashati, Mandalani Patan Kamsha Marichi. So all these describes about the patient says that I can appreciate some moving particles or moving objects in my vision, which are not actually present in the environment. So they are not present in the environment, but still the patient comes and says that I can see something moving in my visual field. So it may be of different shapes. It may be like a makshika, it may be like an insect, or it may be like hairs, or it may be like a web, or it may be a simple round, or it may be any other forms. So that is perceived by the patient. So this is seen when the vitreous undergoes degeneration. Vitreous is a gel-like substance which fills the posterior segment of the eyeball. So normally it should be like a gel. Either because of disease or because of aging, this gel-like vitreous becomes liquid. So in that condition, the person appreciates these type of features where he can see some makshika, mashaka, all those things moving around in his visual field. So when the patient complains of floaters, we have to take it as Vidya Patalagata Dosha Lakshana. Kundalani. Kundalani is distorted vision. He says Karna Kundalani, like ear instead of being seen in its proper place, it may appear somewhere else. So that is distortion of vision which is depicted in this picture. You can see here this picture is clear, whereas here it is distorted. So the severity of distortion is comparatively less when compared to the other, like when Vata is involved, even there is distortion. Even in case of Sannipata Timira, there is distortion, but the severity of distortion is different. Parimplavacha vividan varshamabram tamamsitya. Parimplavacha, he says, nakshatradinam gatihi. That is again flashes of light, which I will explain in further slides. So whenever the patient complains of flashes of light, even that should be taken as Dvitiya Patalagata Dosha Lakshana. Flashes of light means the person will experience some bright light within the eyeball, okay, which is not present externally. That is flashes of light. Durastani च रूपाणि मन्यते च समीपतः समीपस्थानि दूरे च दृष्टे गोचर विभ्रमः. So this is disturbance in the depth perception. The objects which are near may appear to be placed far. The objects which are far may appear to be placed near. So if at all there is a book or pen on my table, instead of directly reaching to that table, I may not be able to gauge exactly where it is placed. So I may have to trace for my pen or book in order to reach that. That is Drishti Gochara Vibhrama. Or whenever we are stepping down the steps, I may not be able to gauge the height of those steps. That is one thing. Or when the patient is driving, he may not be able to make out the space between the other vehicles coming. Okay, while playing, he may not be able to appreciate where exactly the ball is coming. So all these describes about the disturbance in the depth perception. Durasthani picha rupani manyate cha samipataha samipasthani durecha drushtir gochara vibhrama. So this features, they are seen whenever the macula is involved. Macula is a structure, as I told before, where we have the peak vision. So depth perception, color perception, form sense, everything happens because of a macula where we have only cone cells. So that is, if macula is disturbed or macula is affected, then this depth perception also will be affected. And the last point is Suchi Pamsham na Pashyati. Suchi Pasham na Pashyati. Suchi Pasham na Pashyati means the person is not unable to thread the needle. So threading the needle, we don't hold it needle very far and thread it, right? We keep it very close and we are going to thread the needle. So it means that the person will be having difficulty for near vision. So near vision difficulty, it may be as simple as presbyopia. Presbyopia is a condition where the person finds disturbance in the near vision as we age towards 40. So it's a physiological process where the accommodation power will be reduced. So because of that, we may not be able to read out certain small fonts. That is presbyopia. Apart from that, it is seen in case of spasm of accommodation. It can be seen in third nerve palsy. It can be seen in hypermetropia. So many other conditions also this is seen. So whenever the person complains of difficulty for near vision, again it can be taken under Dvitiya Patalagata Dosha. So when the doshas enter into the third petala, what happens? So Urdhvam Pashyati Nada Tritiya Patalagate Mahantya Picha Rupani Chaditani Vavasasa Kardanasakshi Yuktani Viparitani Chavikshate Yatha Dosham Charajita Drishti Doshe Baliyasi Adahastite Samipastam Durastam Choparistite Parshvastite Tata Doshe Parshvastani na Pashyati Samantataha Stite Doshe Sankulani na Pashyati Drishti Madhyagate Doshe Sa Ekam Manyate Thita Dvida Stite Trita Pashid Bahuda Chanavastite Timira Savai Dosha. So here mostly he explains about the disturbance in the visual field. Okay, so visual field is an island of vision in the ocean of darkness. In the sea of darkness, it's a island of vision. For example, how to be very simple, if I close my one eye and concentrate on a particular point, but still some other area around that point I will be able to cover. Like if I see the screen, even if somebody comes from sideways, I will be able to appreciate because that is my field of vision. So this field of vision will be constricted or it can be disturbed. So in this picture, we can see this is the visual pathway, and here there is depiction of different types of constriction of visual field that is depicted here. So whenever the visual pathway is affected, different patterns of visual field constriction can be seen. So that all those conditions comes under Tritiya Patalagata Dosha Lakshana. So there he says if the doshas are situated in the upward portion, the upward vision will be lost, or the upper quadrant vision will be lost. If they are situated in the lower quadrant, then lower quadrant vision will be lost. If they are situated sideways, then respective visual field will be lost. So like that he will explain. So that is about the visual field disturbance. Not only that, in this picture you can see there is constriction of the visual field. The peripheral visual field is completely lost. Only the central vision is preserved. Even this condition also should be taken as Tritiya Patalagata Dosha Lakshana. Here, the dosha is in the center. The dosha, that's why the person is not able to see the central part. Okay, that is seen in case of macular problems. This particular constriction of visual field, it is seen whenever the rod cells are affected, because in retina we have, in the center we have the cone cells, in the periphery we have the rod cells. Rod cells, they are responsible for peripheral vision. Cone cells, they are responsible for the central vision. So when the rod cells are affected, there will be constriction of the visual field. When the cones, the macula is affected, the central vision will be affected. So both conditions should be taken as Tritiya Patalagata Dosha Lakshana. Mahantya Picha Rupani Chaditani Vavasasa. Chaditani Vavasasa, it's very important feature described by patients of cataract. Patients, they come and say that the objects, I feel like objects are covered with a white cloth, or I can see the objects as if I'm seeing through a waterfall. So that is a typical feature presented by a patient of cataract. Then Karnanasakshi Yuktani Viparitani cha Vikshate. So in the first picture, you can see two kids are there, but the person affected with AMD, that is age-related macular degeneration, is not able to see the kid's face, and other things are also blurred. So that is Karnanasakshi Yuktani Viparitani cha Vikshate, which explains about the distortion of the vision. Drishti Madhyagate Dosha Saikamanyate Vidat Sthite Trita Bahudacharana Sthite. It explains about the diplopia, polyopia conditions. So whenever the patient presents with diplopia and polyopia, again we can take it as Tritiya Patalagata Dosha Lakshana. Here the fourth line is very important. Yatha Dosham cha Rajita Drishti Doshe Baliyasi. So in the first two patalas, it will be more subjective. But when the doshas are entering into the third patala, it becomes subjective and objective. Objective means even the physician can appreciate some changes in the fundus or any other structures in the eyeball. So when it comes to kacha, we have to take it as both subjective and objective. Whereas in case of Timira, when the doshas are entering, involving only the first two patalas, it will be mostly subjective. So what is this raga prapti that I will explain? In third patala, when the doshas are entering, there will be raga prapti, which I will be explaining in the further slides. Is the slide moving?
No, ma'am. It's not moving, ma'am.
One second, it's not moving for me also.
Okay.
Okay. So when the doshas enter into the fourth patala, we call it as Linganasha. As I told before, Linganasha is a stage where there is complete Chakshurendriya Shakti Nasha. Chakshurendriya Shakti is the perception of vision. Here it is lost. But this condition should not be taken as PL negative. Like if we make the room dark and we just put a torchlight and ask the patient whether he is able to appreciate light or not. So that is a severe loss of vision, or we can say it as complete blindness. So in those conditions, even if you do some treatment also, it is not of much use. Rather than taking it as PL negative, it should be taken as legal blindness. So legal blindness is a condition where we can certify the patient as blind. We can certify the patient like that. So according to WHO, he says that WHO definition, they say that in the better eye, the vision should be equivalent to 3/60. So in the better eye or in the sound eye, the vision should be 3/60. Then only we can take it as legally blind. Okay. So legally 3/60, when somebody comes near to the patient, till he approaches 1 meter, the person is not able to identify who it is. The patient may appreciate that somebody is coming, but he is not able to make out who it is. So all those conditions should be taken as Linganasha, where the person becomes dependent upon others for his routine activities also. So here the important feature, the clinching feature, what he is saying is, Tasmin api tamo bhute nadi rude mahagade, Chandraditya sa nakshatra antarikshe cha vidyutaha, nirmalani cha tejamsi, brajushnini cha pashyati. Here the main feature is flashes. Okay. Chandra Aditya Sa Nakshatra Antarikshe Cha Vidyutaha, like lightning, like the sun, like a moon. So that much luminous stimulus will be appreciated by the patient. Okay. So that is seen in case of vitreomacular traction. Okay. Vitreomacular traction is a condition where the new blood vessels, they grow on the retina and they proliferate into the vitreous. Along with some fibrous bands, these new blood vessels, they proliferate into the vitreous and they put pressure or they put traction over the retina. So in that condition, the person will experience severe flashes. The patient will exactly come and say that I can feel some fire from sideways, or I can feel some bright light, like that. The patient will say that is nothing but the flashes of light, which is seen in case of vitreomacular traction. This can be seen in many conditions like fractional retinal detachment or CRAO, where there is growth of new blood vessels. In all those conditions, this vitreomacular traction can happen and the person may experience these features. So all those conditions can be taken as the Chaturtha Petalagata Dosha Lakshana. So as I told before, Timira, Kacha, Linganasha, first two patalas when they are getting involved, we call it as Timira. So third patala when it is getting involved, we call it as Kacha. Fourth patala, we call it as Linganasha. Like in fourth Linganasha stage, all the four patalas will be involved. In Timira, it will be mostly subjective. In Kacha, it will be subjective and objective. In Linganasha, it will be both subjective and objective. Even the physician also will be able to appreciate some changes in the eye. Then we have 6 types of Timira: Vata, Pitta, Kapha, Raktaja, Sannipataja, Parimlaya according to Sushruta. According to Vagbata, Vata, Pitta, Kapha, Rakta, Sannipataja and Dvandvaja. So coming to Vataja, Timira, Kacha, Linganasha, all 3 together I'll be explaining. Tatra Vatena Rupani, Brahmantiva Sapashyati, Avilani, Arunabhani, Vyavitani Samanavaha. So Brahmantiva Chapashyati, the person feels as if the objects are moving. The static objects are moving, like that the person will feel. Then Avilata. Avilata is disturbance in the vision, like blurring of vision will be there. Since Vata is involved, the person says that there can be red tinge to the vision. Arunabhani. Vyavidani is Vakrata. So this particular image is of a test called as Amsler grid test, which we do in case of macular whole macular edema. In those conditions, we can do this test. Here you can see there are lines, multiple lines are there, forming some boxes here. The patient will be asked to concentrate on the center point, this point, and will be asked to see whether any distortion of lines is appreciated by the patient or any particular portion is not appreciated by the patient. So that will be asked to mark down. So here you can see there is some distortion of the lines. So this can be taken as Vyavidata, that is Vakrata. So this is the feature of Vataja Timira. Then coming to the Linganasha, Kacha altogether I will explain later. Coming to the Linganasha, Arunam Mandalam Vatam Chanchalam Parusham Tata. And in Ashtanga Hridaya, he says, in Vataja Linganasha, he says, Drak Nadi Sankocha. Drak Nadi Sankocha. So here Drak Nadi can be taken either for macula or it can be taken even for optic nerve also. Optic nerve atrophy, you people might have heard of. It can be primary atrophy or it can be secondary atrophy. You can see here, this is the normal optic disc, and here the optic nerve has undergone atrophy. So in these conditions, Drak Nadi Sankocha, it can be taken as Vataja Linganasha. Chanchalam. Chanchalam is, it can be taken as nystagmus. Nystagmus is seen in cases of multiple sclerosis. In other such conditions, wherever we see nystagmus, that can be taken as Chanchalata. Apart from that, Brahmantiva, it can be seen in myokymia. Myokymia means it's a pulsation what we feel in extraocular muscles. Everybody might have experienced at least once in your lifetime. So we feel some pulsations in the eyelid, right? So that can happen in case of extraocular muscles also. So in that condition, the object will appear as if it is moving. So Vakrata, it is seen in case of astigmatism. So when we ask the patient to read out the Snellen stat, instead of reading it as X, he may read it as K, W as M. So like that, small differences will be there. By that we can make out that it is Vataja Vyavidata is there. Then keratoconus also same thing. Myopia also can be taken as Vataja Timira. Kacha is a stage where we find a typical feature called as Raga Prapti. Raga Prapti can be understood as some change in the appearance of the fundus, or it may be in the lens also. So this is the normal appearance of the fundus. Whereas in case of when the Vata is involved, there will be some changes here. When Pitta also, certain changes we can appreciate, which I will be explaining in the further slides. In Samhitas, no specific feature related to Kacha is explained. Only thing what they say is there will be Raga Prapti depending upon the dosha involved. Specific color will be attributed to the Drishti Mandala. That is what they say in case of Kacha. Specific symptoms, specific lakshanas and all they have not explained. Then we have Pittaja Timira Kacha Linganasha. Pittena Aditya Khadyuta Shakrachapa Tadinganan Shakirbaha Vichitrani Nila Krishnani Chapashati. The main feature is flashes of light. Okay. But the flashes, the intensity of flashes will be less. For example, even in case of pathological myopia is a condition where the refractive error keeps on increasing every year. So even in that condition, the person will experience flashes of light, but the intensity of those flashes will be minimal. So we can differentiate like a sun and a star. The sun is more luminous, whereas star is less luminous. So the intensity will be different between sun and a star. So here the intensity of flashes will be less when compared to the further Patala involvement. So Shikirbaha Vichitrani Nila Krishnani Chapashati. So yellow color discoloration can be seen, or the not discoloration. The person says that I can see some yellow tinge to my vision. So this is about Pittaja Linganasha, Pittan Mandalam, Neelam, Kansyabam, Pitamivacha. So it appears yellow in color and there will be complete loss of vision. Kapaja Kacha, Timira Kacha and Linganasha. Here Kapaja Timira exclusively I would like to take it as cataract, because Kapaja Linganasha is the only Linganasha which is Sadhya, which is Shastra Sadhya. Even when there is Linganasha, even when the person when he is having finger count or hand movement vision also, after surgery he gains most of his vision. It will be almost like normal, near normal. We can see he can regain his vision. So exclusively I would like to correlate or take it as cataract and different stages of cataract. So here in Timira he says, Kafena Pashed Rupani Snigdanicha Sitanicha, Gaura Chamara Gaurani, Shvetapra Pratimanicha, Pasheda Sukshman Adyatam, Yabri Chaivapra Saplavam, Salila Plavitaniva, Parijadiani Manava. So since kapha is involved, there will be whitish tinge to the vision. The person says that as if the objects are covered by a cloth, or I'm feeling like as if I'm seeing a waterfall, or else I'm feeling like something is there in between, like a white cloth. Through that I'm seeing like that the person will experience. Pasheda Sukshman Atyartam, Vyabris Chaivabra Samplavam. So cataract, it leads to index myopia. The index of the lens changes as the cataract matures. Because of that, there can be index myopia, which can be taken for the third line, Pasheda Sushmanatyatam, Veprichayavapra Samplavam, Salila Plavitaniva Parijhadyani Manava. So if you take a tumbler filled with half water and you just keep a pencil or a stick or pen, whatever, something in that, in between the water and the air refractive media, we feel that the pencil is bent. Okay, I think everybody might have observed it. It feels like as if the pencil is bent. So that will be the experience by the patient of Kapaja Timira. Then we have Kapaja Linganasha, Shleshmanam Bahalam Stiktam Shanka Kundendu Panduram, Chalapadma Palashastana, Shuklo Binduri Vampasa, Sankuchete Atate Atyaptam, Chayayam Visruto Bhavit, Mrudyamani Chanayana, Mandalam Tantisarkati. So he describes about different shades of white, like Shanka, Kunda, Indu. Indu is moon. So Shankar or pearl or like a moon, he describes about different shades of white, which is seen in different stages of cataract. So in the initial stages, it may be pearly white, then it becomes milky white. If at all it is not treated, then it will become a hard cataract. Then we can appreciate it as chalky white. So different shades of white, he explains, that is seen in case of different shades of, different stages of cataract. Chalapadma Palashasta, Shuklo Binduri Vampasa. So if you see a lotus leaf, on that there is a water droplet, which is biconvex in shape. Okay, it doesn't stick like this. It will be like a moving pearl over the leaf. So similar will be the appearance of the lens also. Lens also it is biconvex and it appears like a Shikla Bindu. So that can be taken as the biconvexity and the opacity of the lens. Sankuchite atapya atyartam chhayayam vistruto bhavet. So this should be understood as the pupillary reflex when it is present. When the cataract is mature, when we put the light, the pupil will constrict, and when we remove the source of light, it will dilate. So it means that the retina is functioning properly. We can take the patient for the surgery. So till then, nowadays people, they are not waiting. Even the doctors are also not waiting. So they will do surgery even much before also, but it can be understood in those terms. And in case of Ashtanga Hridaya, he says, Murta kafaha drishtigato snigdo darshana nashanaha. In case of Linganasha, he says like, Murta is something which is having a form. Murta kafaha drishtigato. It comes, the Murta kapha or the kapha which is having some form, it comes and sits in the way of Drishti, blocking the Teja Paramanu. Okay, Teja Paramanu is the term which is seen, which is available in Samhita. So Teja Paramanu should be taken as light rays. So the kapha, it sits in the way of Drishti, inhibiting or hindering the entrance of the light rays. So that should be taken as Kapaja Linganasha. So in Kapaja Linganasha Shastra Chikitsa, we have Vyadana and Lekana. Okay, Vyadana is entering into the anterior chamber and Lekana is scraping out the opacity or the removing of the opaque lens. So that can be taken as Vyadana and Lekana. So once we remove the accumulated kapha in the Drishti Marga, the light can easily enter into the eyeball and there can be perception of vision. So Kapaja Timira Kacha Linganasha is different stages of cataract. Raktaja Timira Kacha Linganasha. So he says, Harita Shava Krishnani Dhuma Dhumrani Cha. The person feels smoky vision. The smoky vision, it is seen in case of CSR or some macular edema conditions. The person may say that I have smoky vision, where the vision will be not worse than 6/24. Such conditions can be taken as Raktaja Timira. Pravada Padma Patrabam Mandalam Shonitatmakam. So here we can see Mandalam Shonitatmakam. So there is some change in the fundus, is it not? So this is a huge vitreous hemorrhage, extensive vitreous hemorrhage, where the whole of the fundus or the maximum portion of the fundus, it is appearing red in color. So this is a case of proliferative diabetic retinopathy. You can see vascular tufts, new blood vessels grown here. So the fundus appears more congested. Even that can be taken as Raktaja Linganasha. So this is a condition of vein occlusion, where we can see a tomato splashed appearance. So extensive hemorrhages are also seen here. So again, the fundus appears red in color. So that can be taken as Raktaja Linganasha. Even in case of retinal vasculitis also, there will be repeated bleeding. Even those conditions also can be taken as Raktaja Timira and can be treated in those lines. Then we have Sannipadaja Timira Kacha Linganasha. So here he says, Sannipatina Chitrani Viplatani Chapashiti, Bahuda Chadvida Vapi Sarvaniva Samantaha, Heenadika Anganyatavapi Jyotishyam Chipashiti. So depending upon the involvement or predominance of dosha, that particular lakshana will be exhibited. And also there can be polyopia, diplopia can be seen, which we saw in case of Tritiya Patalagata dosha lakshana. Then Heenadika Anganyatava Jyotishyapti Chapashiti. So Heenadika Anga, again it should be taken as metamorphopsia. So there the severity of distortion was less, but here the severity of distortion will be more. Then we have Parimlai Timira Kacha Linganasha. This is explained only by Acharya Sushita. Vakpata has not explained this. Instead, Vakpata he explains Dvandvaja and Sannipataja. And he doesn't describe about the specific lakshanas. Depending upon the dosha involvement, we can take it as Vata Pitta or Pitta Kapha, whatever it is. So Parimlai Timira Kacha Linganasha. Sushruta, he says, Pittam Kuryat Parimlai, Muchitam Rakta Tejasa, Pita Dishastata Khadyoda Antamatimiva Pashyati, Vikiriamanan Khadyoda Vriksham Tejobirevacha. Okay, so the important feature here is involvement of Pitta and Rakta. Murchitam Rakta Tejasa. For Rakta Tejasa Dalhana, he comments as Bhakta Tejasa. For Bhakta Tejasa, again he says that Ahara Parinamyamana Rasa. So here the lakshanas exhibited by the patient depends upon the Ahara Parinamyamana Rasa. That is the food or the food which is metabolized. The quality of that metabolite can be taken as Bhakta Tejasa. So that can be understood as a case of diabetic retinopathy. As we all know, if the patient is having good glycemic control, then the retinopathy changes will be minimum. and the glucose level or the glycemic index of the patient is considered to be a major risk factor for the development of diabetic retinopathy. If the sugar levels are more, the person will have more blurring of vision. Even while prescribing spectacles also, if the patient is diabetic, we have to identify whether we have to know whether the sugar levels are controlled or not. So until and unless the sugar levels are controlled, better not to give any correction. So the Lakshanas of Parimlai Timira is completely dependent upon the quality of the Ahara Rasa, that is the sugar levels or the glycemic index. So with this comparison, we can take it as diabetic retinopathy, or diabetic retinopathy can be managed in terms of Parimlai Timira, which is caused due to the involvement of Pitta and Rakta Dosha. So again, he explains as Disham Khadyota Antam Adyamiva Pashyati. So this is seen in later stages. As I told, vitreomacular traction. In case of diabetic retinopathy, the viscosity of blood will be increased, because of which the small capillaries of the retina will be blocked. So when the small capillaries are blocked, what happens? The periphery of the retina will not be getting sufficient oxygen. So it creates a state of hypoxia in the retina, which stimulates the growth of new blood vessels. So there will be neovascularization. When there is neovascularization, these new blood vessels, even they can proliferate into the vitreous, forming vitreoretinal tractional bands. So these bands, they pull the retina, or they put traction over the retina, because of which there will be flashes of light, which we can understand as Disham Antam Aditya Khadyota, Antam Aditya Miva Pashyati. So severe flashes of light will be seen. The person even feels that Khadyota Vraksham stage of Irivacha, as if the whole tree is burning. So that will be the severity of flashes of light. So with this, we can understand like the Parimlai Timira can be taken as diabetic retinopathy. So Kacha, altogether Kacha I am explaining here. Kacha is a stage where the doshas are entering into the third patala. So where we can see some objective changes, where the physician can appreciate some changes in the appearance of the fundus. So when Vata is involved, there will be Aruna Varna. Obviously, when Pitta is involved, there will be Pita Varna. When Kapha is involved, there will be Shweta Varna. When Rakta is involved, there will be Rakta Varna changes. So in the first picture, we can see this is a condition called as Retinitis Pigmentosa. This is a genetically inherited condition where there will be dystrophy, pigmentary dystrophy of the rod cells. Okay, as I told before, the rod cells, they are concentrated in the periphery of the retina. So here we can see pigmentary dystrophy of the rod cells. So the whole of the fundus, it appears blackish in color, and also there is optic atrophy here. Okay, so depending upon all these features, we can take it as Vataja Kacha, and further it will lead to Vataja Linganasha. So this is a case of diabetic retinopathy. So here we can see some exudates. The fundus appears little bit more yellow in color than the normal. So depending upon that feature, we can take it as Pittaja Raga Prapti. Here this is the case of cataract. As I told before, when Kapha is involved, there will be Shweta Parna impartition will be there. So this can be taken as Kapaja Kacha, and whenever there is extensive hemorrhage, here we can see the vascular tufts also. So the fundus appears congested, it appears more red in color. So this can be taken as Raktaja Kacha. So this changes in the fundus can be taken as can be taken as Raga Prapti, which is the typical feature when the doshas are entering into the third patala. So coming to the evaluation, the first thing what we have to do is we have to record the distant vision and near vision. This is the Snellen's chart. Okay, so we have to ask the patient to sit at 6 meter distance and ask the patient to read out. So if the person is able to read the last line, then we record it as 6 by 6, and accordingly 6 by 9, 6 by 12, 6 by 18, like that we will record. If the person is not able to read at the distance, read the topmost letter at 6 meter distance, then we start reducing the distance by 5 meters, 4 meters, 3 meters, 2 meters, and 1 meter, and we record it accordingly, like 5 by 60, 4 by 60, 3 by 60, 2 by 60. Even at 1 meter distance, when the patient is unable to identify the topmost letter, then we go for finger count. We ask the patient at half meter distance, like how much is this, how much is this, like that we can show the fingers and ask the patient to count it. That is finger count. If finger count is not there, then we have to go for hand movements. Just wave your hand in front of the patient's face and ask patient's affected eye and ask whether the patient is able to appreciate the waving of the hand. Then we have to record it as HM positive, hand movements positive. If hand movements are not positive, appreciated by the patient, then we go for PL. PR, projection of light. So turn off the lights in the examination room, then take a torch, then you project it from the sideways, upper quadrant, lower quadrant, temporal nasal side and all. We project it and we ask the patient whether he is able to appreciate it, and I record accordingly. So this is the procedure of examining the distant vision. Then if the patient's vision is not, if at all it is less than 6/6, then we have to go for a test called as pinhole test. So as we can see here, this is the pinhole. You can see at the center there is a small hole. Okay, the diameter will be approximately 0.5 mm. So we have to place this pinhole. One eye should be occluded and the other eye should be placed with this pinhole, and ask the patient whether he can, whether there is any improvement in the vision than before. Suppose the patient reads only 6/18 before, and you keep the pinhole and ask the patient whether further lines he can appreciate. If at all there is improvement in pinhole test, then we take it as a refractive error. If at all there is no improvement in pinhole test, then we have to go for further evaluation of the retina. So this test is very, very important, which helps us to differentiate between a macular lesion and refractive error, pinhole test. Then this instrument is called a slit lamp examination, where we can get a magnified view of the cornea, lens, detailed examination of the anterior chamber, even up to vitreous also we can do. We can examine. So this instrument is very important, slit lamp. Then we have IOP. So IOP is mandatory for all the patients. We have to check the intraocular pressure. Then we have indirect ophthalmoscopy. This picture shows about the indirect ophthalmoscopy, which helps us to examine the retina. Okay, retina, optic nerve, macula, even the periphery, all those things can be examined with the help of this instrument, which helps us to identify whether the macula is fine or optic nerve is having any problem. All those things we can examine. So for further confirmation of your provisional diagnosis, we can go for OCT, optical coherence tomography of macula. If you're suspecting something with the macula, you can go for macula, or we can go for optic disc OCT also. Field analysis. So this is the report of field analysis, where we can identify how much constriction of visual field is there, or how much light threshold has lost. The patient has lost the light threshold, that we can identify. This is done usually in case of glaucoma. Sometimes in case of RP also we can rely on this. So these are the additional investigations which we can ask the patient to get it done in case of any doubt. So coming to the chikitsa, before going to the chikitsa, it's important to know the netra, ama and nirama lakshana, because we have kriya kalpas, seka, ashtratana, tarpana, anjana, pidalaka, all those things. In all the conditions, we are not supposed to select any of the, randomly we can't select any of these kriya kalpas. Before going for selection of the kriya kalpas, it's very important to identify whether the patient is in netra is in amavastha or niramavastha. Like how we before doing the snehapana, we do deepana pachana. In a similar way, before opting for the treatment procedures, we need to know whether the there is netragata ama or whether it is in niramavastha. So netra amavastha in Yoga Ratnakara, you'll get this reference. Udirna Vedanam Netra Raga Shoka Samanvitam. So if at all the patient is having severe pain, swelling, gharsha and all, so that is considered as netra ama lakshana, and we have to bring the ama netra into niramavastha by doing certain procedures like seka, bhuma, vidalaka, avagundana. All these procedures can be adopted to bring the netra ama into niramavastha. In certain procedures like anjana, tarpana, putapaka, it is absolutely contraindicated in case of netra ama lakshana. So it's important to identify this ama and niramavastha even before choosing the kriyakalpa procedures. Apart from that, we have to consider the rogibala and rogabala. So rogibala, if at all it is good, if the rogibala is good and if at all it is a navavyadi, then we may not have to opt for the whole of the chikitsa sutra. Rather, one or two procedures of those we can adopt and we can effectively manage the condition. But if at all it is a long-standing condition or there is systemic involvement, then definitely we have to take some support from Panchakarma. Along with that, we have to do some Kriyakalpa procedures. So the stage of the disease, the strength of the patient, the strength of the disease, all these things should be considered before planning the treatment. Vataja Timira Chikitsa, it's more theoretical. Further, we can go for practical portions. These are the Chikitsa Sutra, what he is explaining, Ashtanga Hridaya. Sneha Astra Vistravana Rekanasyehi Upacharit Anjana Muta Vasti Vasti Kriya Tarpana Lepa Sekaihi. This is the general line of management for all types of Timira. First thing is Sneha Astra Vistravana Rekanasyehi Virechana Raktamokshana Nasya Anjana Murdavasti Vasti. Then Kriyakalpas like Tarpana, Lepa, Seka and all we can adopt depending upon the condition. It is not mandatory that for one patient we have to follow all these treatment. It is not like that. Depending upon the patient, we can choose some procedures from this and we can treat the patient. In case of Vataja Timira, Dashamula Ambasa Gritam, Shire, Chaturgune, Shreshta Kalkam, Pakvam Pipi. So Dashamula Grita should be given, Snehabana, then Jivantyadi Taila Nasya can be adopted. Shatavadi Tarpana Grita is specifically indicated in case of Vataja Timira. Dashamula Jivantyadi Grita is indicated. Dashamula Tripala Grita can be used for Tarpana. Apart from that, we can go for Vasti and some Anjana procedures like Vasa Anjana. Vasa Anjana I have specified because it is Vata and Vasa is good for Vataja condition. So Vasa Anjana can be employed here. In case of Pittaja Timira, we can adopt Jivanti Tripala Grita can be selected. Trivrit Virechana. In case of Vataja Timira, we have to go for Virechana with Eranda Thaila or we can go for Tripala Churna. Along with some Thaila only we have to prescribe. Panchangula Thaila specifically indicated in case of Vataja Timira. In case of Pittaja Timira, we can go for Trivrit along with Chakara for Virechana. Sarivadi Varti, Jivaniyagana, Dhritanasya. This is very important. There we can take even Kakulyadi Gana also. Sarivadi Varti Anjana and Mukhalepa. So this is a specific yoga like Mukhalepa. When we study Dinacharya, we say Mukhalepa is Dardikaram. But in which condition we have to do Mukhalepa, that is not specified. But in case of Pittaja Timira, specific references of Mukhalepa is there. The main drawback of Shalakya practice is we don't get references for internal medications. Rather, we have to take support from Sutrasthana. So that is the main hindrance we have in Shalakya practice. Other than that, most of the yogas, whatever they have mentioned in Shalakya, Chikitsa, they are not available. They are not market available. Most of the time, we may have to prepare it by ourselves. That is one more problem with Shalakya practice. Then in case of Kapaja Timira, we have two stages. In the initial stages, they say Bheshaja Karma. In later stages, we have to go for Shastra Karma. Even in Ayurveda, they say whenever it is advanced condition, we have to go for Shastra Karma. In initial stages, we have to go for Bheshaja Karma. We can go for Tarpana. Usually, when we think of cataract, everybody thinks of giving some Lekana Anjana. It's not only Lekana Anjana, even Tarpana Yoga also it is mentioned in Sushruta Uttaratandra. He says Vanaspati Grita. Vanaspati Grita is Ksheri Vriksha Kashaya. We have to take along with that Haridra and Nalada. Kalka Churna should be added and we have to make Grita out of it, and that Grita should be used for Tarpana. So Tarpana is also indicated in case of Kapaja Timira. It is not only the Lekana Anjanas what we are going to employ here. Apart from that Vanaspati Grita, we can go for some lesser Tarpana Gritas like Tripala Grita, we can do Patala Grita Tarpana. So such Gritas we can use for Tarpana here. Apart from that, some Shodhana Nasya like Kriberadi Nasya. Then Anjana yogas like Vimalavarti, Drak Vaimalyakaram, Vimalavarti, Kokilavarti, Drashadi Gulika, even for Anjana can be used. So in later stages, usually what I do in practice is I give medicine for 3 months. If at all the patient's vision is improving, then I continue with the Bheshaja Karma, or else I suggest the patient to go for surgery. So in Ayurveda also, cataract surgery, the Kapaja Linganasha Shastra Chikitsa, it is having 2 parts, Vedana and Lekana. What we can understand as SICS, like entering into the anterior chamber and scraping out the Murta Kappa which is accumulated in the Drishti Marga. Raktaja Timira, the similar lines of management of Pittaja Timira should be advocated here. The important thing what extra we can do here is Rakta Mokshana. One point I would like to highlight here is Rakta Mokshana is indicated in case of Timira stage, but it should never be done in case of Kacha stage. Especially Sira Vedana is contraindicated in case of Kacha stage. There he says, Enthropedita Dosha, Hanya, Ashu Darshanam. So if at all you use some instruments to do some Rakta Mokshana, it will increase the doshas, it will aggravate the dosha and immediately there can be vision loss. So in case of Kacha stage, we should never go for Sira Vedana. If at all it is very much needed, in case of Pitta or Raktaja Kacha, we can go for Jalauka, but never Sira Vedana. Tanipataja, again, we have to analyze the dosha, which is the predominant dosha that has to be considered and accordingly it has to be treated. Parimlaya Timira, Pitta Rakta should be addressed, both should be addressed. It should be more of Pitta Shamana and Rakta Prasadana Chikitsa should be adopted here. Some specific yogas like Madhukadi Thailanasya, Kanasendvanchana can be employed. So these are other formulations which can be used for Timira Chikitsa like Jivantyadigrita, Jivanti Dashmulagrita, Shatavati Tarpanagrita, Trivalagrita, Mahatrivaladigrita, Patoladigrita can be used. Some other yogas like Churnanjana, Bhaskara Churna, Drikprasadananjana, Tuttanjana, Gritranjana, Krishna Sarpa Vasanjana, Ukkata Purishanjana. These are all theoretical things. As I told before, these are not market available. Other market available drops like Elir Colombo and some patent drugs are also there which we can use for as eye drops in these conditions. So coming to some case discussions, first is of myopia. So that was treated on the lines of Vataja Timira. So it was a case of 19 years male patient complaining of the blurring of distant vision for 12 years. He was not wearing glasses. Instead, he was managing with by twitching his eyes, and he was made to sit in first bench so that he can overcome his problem. So on examination, his vision was 6/24. When we did pinhole examination, so in right eye it was 6/9 and left eye it was 6/12. Sorry, 6/6. By that we can make out that this is a case of myopia, and it was taken as Vataja Timira. And the chikitsa adopted was Depana Pachana, Snenapana, Virichana, Nasya Anjana, and Tarpana. Tarpana mostly in case of myopia, Shatavadigrita Tarpana or Anantadigrita Tarpana, which is mentioned in Chikitsa Manjari, they gave wonderful results. So after doing the one course of treatment, the vision improved up to 6/12, 6/9 also. And then it was maintained with some Aschotana drops. Then this is the case of Parimlaya Timira, a 56-year male patient. He was a physical education teacher by profession. Diabetic since 7 years. It was poorly controlled, and it was in allopathy hospital. It was diagnosed as a case of NPDR with macular edema, and he was suggested for injections also. Steroid injections, intravitreal injections was suggested. So he was not interested for that. So he came for Ayurveda treatment. On examination, his vision was 6/24 and 6/9. On examination, microaneurysms, hard exudates, soft exudates were seen. Macular edema in the right eye was seen. The features were more in right eye when compared to the left eye. He was suggested for IVTA. So the treatment done was Mrudu Virechana we have to perform because here already the netra is, already the retina is very weak. We should not go for some vigorous treatments here. Rather, we have to go for some supportive treatments. So Mrudu Virechana will be sufficient in such conditions. Apart from that, supporting treatments like Takradhara. Okay, so for Takradhara, we can add some kashayas also, like Vasaguduchadi Kashaya, Triphala Kashaya also can be added. Takradhara gives wonderful results in case of diabetic retinopathy along with macular edema. It gives wonderful results. Then Mukhalepa, Pratimarshanasya, Talam, Netrazeka, Ashtotana, Anjana was adopted. And the vision was improved to 6/9. And when he went for follow-up in the allopathy hospital, they told he was suggested like need for any injection is not needed there. So further we could maintain by Ayurveda treatment. Kafaja Timira. So as I told before, in some patients, depending upon the stage, there will be good improvement. If at all the stage crosses, like immature stage crosses, and if at all it is becoming mature, the visual outcome will not be so much, very much supporting. It was a 60 years old male patient, 60-year-old male patient, blurring, complaints of blurring for distant vision and near vision since 1 year. Vision was 6/36 and 6/24. On examination, it was SIMC, senile immature cataract, both eyes. So treatment was Mrudu Shodhana was given. Apart from that, Triphala Churna at bedtime with honey was given. This is indicated in cases of kaphaja disorders, netra diseases. Then Elnir Colombo was given, followed by Kshalana, Ushnajala Kshalana, and then vision improved up to 6/18. And more than vision improvement, the quality of life of the patient was improved, usually which is neglected in the contemporary medical science. So this is a case of sarcoidosis. It is taken as Sannipataja Timira. It was taken as Sannipataja Timira. 52 years female, severe pain and redness in her right eye since 2020 March. It was a diagnosed case of ocular sarcoidosis. Initially she was misdiagnosed as a case of Cox and treated accordingly, and then she developed ethambutol toxicity. Then the Cox treatment was stopped. Then she was put on immunosuppressants. Then later she developed uveitis. Then she was put on pilocarpine and again immunosuppressants. Then the uveitis features were reduced, but still the symptoms were controlled. But even when she was on treatment immunosuppressants, she had severe eye pain and redness, which was not reducing. So she came for Ayurveda treatment. So we had planned for Deepana Pachana, Snehapana, Virichana, and supportive procedures like Padalepa and Mukhalepa in the first sitting. Then in the second sitting, we could go for Jalavakavacharana, Takradhara, Nidraseka, Bidalaka, Astutana, and Anjana. So after treatment, the patient was very much comfortable. The pain, her eyes were sunken actually before treatment. So after treatment, it has improved a lot, and the quality of life of the patient was also improved. So coming to the conclusion, it's very important before taking up the patient for treatment. It's important to locate what is the cause of blurring of vision. As I told, there are wide range of causes. We have to identify what is the cause and educate the patient about that. If at all the prognosis is guarded, and we have to educate the patient that even after doing the treatment, there may not be much vision, because the patient will be having a lot of expectations, because eyes, they're very important, right? And analyze the doshas and patalas involved, depending upon the lakshanas, whatever we have in our samhitas. Consider the Rogibala and Rogabala when you're opting for procedures. Either it may be Panchakarma procedure or it can be Kriyakalpa procedure. For both, this is very important. Panchakarma along with Kriyakalpas in long-standing cases and systemic conditions. Whenever multiple conditions are there, when there is systemic involvement, always better to go for Panchakarma before starting the Kriyakalpa procedures. Meticulous choice of treatment procedures and medications, it is important. So with this, I conclude. If at all there are inquiries, I would like to answer that. Thank you.
Thank you, ma'am. Thank you so much, ma'am, for taking your time to prepare such an extraordinary, enlightening session, ma'am. We will now go ahead to the question and answer session, ma'am. Shall we begin, ma'am?
Yes.
Delegates can post your questions in the chat box, or you can raise your hands. Ma'am, there are a few questions, ma'am. May I read it out to you, ma'am?
Yes, please.
Yes, ma'am. The question is, please tell about the management of vitreous hemorrhage in a patient having diabetes mellitus and hypertension, ma'am.
So vitreous hemorrhage, as I told before, it should be taken as pitta and rakta involvement. First, we need to identify what is the cause of vitreous hemorrhage. It can be because of, as I told before, veins block, or it can be because of diabetes, or it can be because of vasculitis also. Right now, we have a case of vasculitis. So, ill-stasis where there will be repeated hemorrhage. So, first we have to identify what is the cause of hemorrhage. Just for resolving the hemorrhage, we can go for Kshira Seka, Manjishta Kshira Seka, Manjishta Tali also we can perform. Manjishta Tali is a procedure where we can prepare Manjishta Kshira Kashaya and make it semi-solid, like Rasakriya consistency we can make. We apply it over the gauze and put it over the eyes for some time, like 15 to 20 minutes. That is also beneficial. Apart from that, we can go for Dhara, Takradhara. That is also very much beneficial. Then we can go for Talapodichal. Talapodichal is a procedure where we are going to cook some medicines. Actually, the medicines and all, it is not explained in specific to these diseases. Depending upon the yukti, Shitavirya drugs like Eshtimadu, Manjishta, Amalaki, Vasa, Punarnava, all those drugs can be taken. It can be cooked in buttermilk. for this vitreous hemorrhage condition, it can be cooked in buttermilk, and we have to apply over the whole head, where a little bit thick, almost like ½ inch. We have to apply and cover it with the banana leaf, and leave it for 2-3 hours. So that is very much beneficial in reducing the vitreous hemorrhage. So within 1 week or 10 days, the hemorrhage will reduce, if at all it is of moderate severity.
Thank you, ma'am. Moving on to the next question, ma'am. How can we manage viral optic neuritis, ma'am?
Optic neuritis. Optic neuritis, in acute stages, usually the patient doesn't come. Even if they're coming in acute stage, in case of optic neuritis, first thing what we have to do is we have to go for Virechana. Snigdha Virechana we have to opt either with Erandathyla. We have to do one Virechana. Then we can opt for, we should not go for Tarpana and Putabaka, rather we have to go for Seka. Seka with Triphala, Manjishta, such drugs we can opt. Apart from that, Padalepa, Mukhalepa also will be beneficial. Mukhalepa, Padalepa, we can opt for Jatamayadi. So that is good.
Thank you, ma'am. Moving on to the next question, ma'am. What may be the Ayurvedic diagnosis in case of myopic astigmatism, ma'am?
Myopic astigmatism, we have to take it as Vataja Timira. So as I told, in Vataja Timira, we have Vyavidata, we have Avidata also. So Vyavidata, as I told before, in astigmatism, when we ask a patient to read out the Snellen's chart instead of X, they may read it as K. So that is a typical feature of astigmatism. So that can be taken as Vyavidata. So both the features they are seen in case of Timira, Vataja Timira. So myopic astigmatism should be treated on the lines of Vataja Timira.
Thank you, ma'am. Moving on to the next question, ma'am. In a 30-year-old female, macular degeneration treatment, ma'am.
Macular degeneration. Okay, macular degeneration, it's of like Tritiya Patalagata, Vataja, we have to take. There will be scotoma. So in this condition, we have to go for Virechana, Snigdha Virechana, followed by Tailadhara, Shirodhara, Nasya, Brahmana Nasya we have to do with Kshirabala Taila or Dhanvantram 101 we can adopt. And this will be sufficient. Virechana, Shirodhara, Nasya followed by Dhara followed by Nasya.
Thank you, ma'am. Moving on to the next question, ma'am.
Yes.
Treatment for reddish growth on sclera near cornea. Modern doctors said it's immunocompromised, ma'am. What will be the condition, ma'am? How to...
First, we have to know what is that growth. Immunocompromised growth. Usually, growth near the cornea or sclera, either it can be because of, it can be a pterygium or it can be a pinicula. So these are the two growths what we can see in there, or it can be some cyst and all. But we have to identify what is the cause. We have to examine the patient properly. Then only we can tell what better we can do. If at all it is a simple growth, then we can choose one Virechana followed by Lekhana Anjanas, Ellir Kulambu, or Nayana Sukhavarti Anjana with honey. That will be beneficial actually for growths.
Thank you, ma'am. Moving on to the next question, ma'am. In floaters treatment with normal 6x6 vision, ma'am.
Actually, floaters, even if you are doing treatment also, the outcome is very minimal because vitreous, once it undergoes degeneration, again it will not become like a gel. So we can try some Brahmana Nasya over there. Some Dhara. Instead of Dhara, we can modify it as Shiro Pichu. Nasya and Pichu may be helpful.
Okay, ma'am. Thank you, ma'am. It is out of portion, even though I'm reading the question, ma'am. What precautions we give during pregnancy to avoid Netra Roga, ma'am?
Okay. During pregnancy, the main problem what we can face is, what a lady can face is the pituitary hypertrophy will be there. The pituitary gland just sits above the optic chiasma. So when there is increase in the or enlargement of the gland, it will put pressure over the optic chiasma, and there can be some visual field disturbance, but that is usually reversible. So after delivery, usually it will be reversible. Apart from that, if at all the lady is diabetic, the pregnancy can sometimes worsen the diabetic condition, and that has to be treated according to Parimla Timira lines of management.
Thank you, ma'am. There is a case, ma'am. May I read it out, ma'am?
Yes, please.
Yes, ma'am. One of the patient is getting chalazion and reddish mass growth in left eyelid. He has been using tetracycline ointment, hot compression, and has taken antibiotic megapen sometimes. He feels relaxed and the size of mass is reduced. But when he awakes for late night, the mass will be increasing in size. He also used Kanjanara Bugulu, but now his symptoms is now as what it is, neither increased nor decreased. Is there any specific treatment in Ayurveda, ma'am?
Okay. Chalazion, if at all it is big enough in size, we have to go for Bhedana. But as the history says, the size is very small and it is repeated. First thing what we have to do is we have to go for Vandipana Pachana, Snehapana, Virechana. To avoid recurrence, it's better to go for Shodhana, followed by Jaloka Vacharana. Okay, so we have to avoid the eyelid and we have to put the Jaloka over that particular point. So even the smallest chalazion will resolve by putting Jaloka. By applying Jaloka, it will resolve. So internal medications may not be of much use in this particular condition. We have to go for one Virechana to avoid recurrence, and also to treat the swelling, the small swelling, we can go for Jaloka. Bidalaka also will be helpful.
Thank you, ma'am. Moving on to the next question, ma'am. Can Gokilavarti Anjana helpful in managing the diabetic retinopathy, ma'am?
Gokilavarti, if at all it is superimposed with cataract, it will be beneficial. Otherwise, we have to go for some Prasadana Anjanas in diabetic retinopathy rather than going for some Tikshna Anjana.
Okay, ma'am. Thank you, ma'am. Moving on to the next question, ma'am. What is the management of rod and cone dystrophy, ma'am?
Rod dystrophy is different, cone dystrophy is different. Rod dystrophy, we have to treat on the lines of Kapha Vidagdha Drishti. Cone dystrophy, we have to treat on the lines of Pitta Vidagdha Drishti. Both are little bit different. In both the condition, again, we have to go for Virechana. In Kapha, better to go for Trivrit Virechana. In both the condition, we can go for Trivrit Virechana. In Kapha Vidagdha Drishti, we have specific Anjana yogas, which even we are also practicing. That is Ekrit Pippali Yoga, where we are going to take the liver, make it as slits and stuff it with Pippali. That is given for Putta, and those Pippali we have to collect. It can be given internally also, even it can be used as Anjana also. That gives very good results in case of rod dystrophies. In case of cone dystrophy, we have to go for Tarpana. Tarpana with the Jivantyadigritta, we can adopt. After Virechana, we can adopt Tarpana. Even we can do Shirodhara also.
Okay, ma'am. Thank you so much, ma'am. Moving on to the next question, ma'am. Is it good to recommend laser coagulation in diabetes retinopathy patients from Ayurvedic point of view, ma'am?
No, definitely laser is not good, because laser, they are what they are doing is, we have, in case of diabetic retinopathy, in case of diabetes, the viscosity of the blood will be more. It is going to block the small capillaries, because of which there will be an area of hypoxia in the periphery of the retina. What they are going to, because of that hypoxia, there will be growth of new blood vessels. It will stimulate the VEGF factors, vascular endothelial growth factors, and there will be growth of new blood vessels. So in laser, what they are going to do is, they are going to burn out those hypoxic area, so that the hypoxic stimulus will be reduced and the VEGF factors will not be released. So in turn, indirectly, what they are going to do is, they are going to damage the retina, the periphery of the retina. Rather than that, we have to improve the blood circulation. That is what I was saying. We have to go for Rakta Prasadana Chikitsa. That definitely, in Ayurveda point of view, laser, it is not good.
Thank you, ma'am. Moving on to the next question, ma'am. Ayurvedic treatment for myopia, ma'am.
Myopia, if it is simple myopia, do one Mridu Shodhana, go for Tarpana. Tarpana with Shatavadikrita or Anantadikrita, it is very beneficial. Shatavadikrita, it gives wonderful results in case of simple myopia. If at all it is pathological myopia, Virechana, Shirodhara, followed by Tarpana.
Okay, ma'am. Thank you, ma'am. Moving on to the next question, ma'am. For Thaila Dhara, which Thaila better for macular degeneration, ma'am?
For macular degeneration, we can go for Bala Thaila, Shirabala Thaila, Dhanvantara Thaila. These three we can opt.
Okay, ma'am. Thank you, ma'am. Moving on to the next question, ma'am. Treatment for autoimmune disease of the eye. Patient is on continuous steroidal eye drops, and if he stops, there will be severe eye redness, wherein he can't work on the computer, and he is a software engineer, ma'am, for the treatment, please, ma'am.
What is the question?
Ma'am, autoimmune disease of the eye, ma'am.
Autoimmune disease, okay.
Patient is on continuous steroidal eye drops, and if he stops, there will be severe eye redness, wherein he can't work on the computer, and he is a software engineer, ma'am.
So this is what I described about my last case. So that was a case of ocular sarcoidosis. So that is also an autoimmune condition. Even when the patient was on immunosuppressants, also the symptoms like severe eye pain and redness was still there. So what I suggest is, along with the allopathy treatment, better to start with some Ayurveda treatment, so that the symptoms will definitely reduce when they start with Ayurveda treatment. So for redness and pain, we can go for Jaloka Vacharana or Shodhana. One Shodhana we have to do, followed by Jaloka Vacharana. Jaloka is very good for this particular condition. I hope so. But after seeing the patient, after examining the patient only, better to plan rather than blindly doing Jaloka Vacharana.
Thank you, ma'am. Moving on to the next question, ma'am. Can you please repeat for treatment for Roth's dystrophy, ma'am?
Rod dystrophy, we have to treat on the basis of Kapha Vidagdha Drishti. So we can go for Virechana there. Then Dhara, again Thaila Dhara we have to perform. In Pitta Vidagdha Drishti, we can go for Kshira Dharas. In Kapha Vidagdha Drishti, we can go for Thaila Dhara. Then we have to do Nasya for Rod dystrophy, right? Ekrit Pippali Yoga, Dadi Maricha Anjana, that is also good. Ekrit Pippali Yoga, liver, goat liver we have to take. We have to make slits in that. Stuff those slits with Pippali, and we have to subject it to Putta, means dry heat. So after the ball gets cold, normal temperature, we have to collect the Pippali, make it as powder, and that should be used as Anjana, and that can be given internally also.
Thank you, ma'am.
That will be beneficial for Rod dystrophy.
Thank you, ma'am. Moving on to the next question, ma'am. Virechana can be beneficial in retinitis pigmentosa, ma'am. And with which Virechana drugs we have to give Virechana, ma'am?
Virechana, retinitis pigmentosa, as I told, we can take it as Vataja Linganasha. So there Panchangula Thaila Virechana is advocated. So Eranda Thaila will be good for Virechana. Along with milk, we can give.
Okay, ma'am. Thank you, ma'am. Moving on to the next question, ma'am. Which Grida to be used for Tarpana in cataract, ma'am?
Cataract actually, specifically in Samhitas, they have explained Vanaspati Grita. So Kashaya should be Kshiri Vriksha Kashaya, Kalkadravya should be Haridra and Nalada, but that is not market available. So and instead of that, we can go for Triphala or Patala Grita for Tarpana in cataract.
Thank you, ma'am. Moving on to the next question, ma'am. How many times should we do Jalokavacharana, ma'am?
Jalokavacharana, it depends upon the condition of the patient. Sometimes if the Rogi Bala is less, one sitting may be enough. Depending upon the condition, we can repeat the Jaloka sittings. But in between, we have to take some gap, at least 3 days gap or 4 days gap we have to take. And if at all you are planning for more sittings of Jalokavacharana, better to put the patient on some Shamana Sneha so that we will not have Vata Prakopa. So have a check on Vata Prakopa, give some Sneha in between, then you can repeat the Jaloka.
Thank you, ma'am. Ma'am, the session is live stream. There are a few questions in the YouTube, ma'am. May I read it out, ma'am?
Yes, please.
Please explain Takradhara in eye condition with different formulation as you said some Kashaya, ma'am.
Takradhara, plain Takradhara usually we prefer to do it in Pitta Rakta related conditions. So in Pitta Rakta related conditions, we can go for plain takradhara, or that will be processed with amalaki, as you know. Along with that, we can use tripala kashaya. Tripala kashaya along with takra we can use for dhara, or vasa guduchari kashaya. Vasa leaves along with some guduchi, that also can be processed with added with dasvarasa, can be added with buttermilk, and that can be used for dhara, takra dhara, shirodhara. Even kshira dhara can be used, can be done, not in dashamula kshira dhara. So like that plain kshira dhara also we can do.
Thank you, ma'am. The question is, it's a case, ma'am. Even after replacing lens for 2 times, there is no vision improvement, ma'am. Will tarpana be useful in this condition, ma'am?
Why was the lens replaced twice? That is the question now. Because nowadays the quality of lens is too good. Even the chances of PCO, like after cataract, is also very less nowadays. So first we need to know why the lens was replaced twice, the first point. And the second thing is we need to examine the retina. So if at all the retina is having some problem, if the macula is having some problem, we need to identify that cause and then plan for treatment. So tarpana directly may not be beneficial. First we have to identify what is the condition, then plan accordingly.
Thank you, ma'am. Moving on to the next question, ma'am. Please tell us clinically what kalpa and which panchakarma procedure should be given in diabetic retinopathy for a confirmatory result as per your experience, ma'am.
For diabetic retinopathy, see, in diabetic retinopathy, we have different stages. NPDR is there, PDR is there, then complicated stages also there. In case of NPDR, we can go for Virechana. Okay. Then we can go for Tarpana. Tarpana also can be done with Mahatripladigrita or Triplagrita. Tarpana can be adopted. Along with that, supporting procedures like Seka, Tali, as I told before, Kshira Kashaya Seka, Manjishtari Tali or Shti Tali, like that we can do. In case of severe NPDR, we can go for Talapodichil. Whereas in case of PDR, better to avoid some vigorous treatments like Virechana, because the retina is already weak. We may damage because of the pressure and all, there may be some chances of hemorrhage. So better to avoid some vigorous treatment in case of proliferative diabetic retinopathy. So in proliferative diabetic retinopathy, again we can choose dhara, takra dhara, then mukha lepa, pada lepa, along with procedures like Seka, Aschotana can be performed. In case of macular edema, takra dhara, talapodichil, that will be beneficial.
Thank you so much, ma'am. That's all for the question session, ma'am. Shall we wind up the session, ma'am?
Yes.
Yes, ma'am. Thank you, ma'am. Thank you all for patient listening and valuable time spent. I'm summing up the session with Nelson Mandela's words. It always seems impossible until it's done. To know more about our updates, please do stay connected with our social media platform. Thank you, ma'am. That was really a wonderful session which enlightened us all, ma'am. Thank you. That's all for today's most interesting session with lots of new information for us to close our eyes with thought-provoking knowledge. Thank you all for joining us. Thank you.
Thank you.